Okay, hi. It's very chilly today. I just want to quickly talk a little bit about knees. Knee range of motion and mobility, and knee health, so joint integrity on the knee. What we typically think of as a knee is this joint that opens and closes. So we think of this hinge joint that just opens and closes. So it extends and it flexes, very much like the elbow. So it extends and it flexes, and that's what we're thinking about. But there's a range of motion that's often overlooked, and it's probably the knee's primary range of motion, and that's the ability to handle this torsion or this rotation, so a twisting rotational force. And that kind of feeds through this whole mechanism. So the rotational capacity feeds this open close, and it gives you a little bit of play either side of a specific line. So I'll give you an example. Is if you're looking at my shin, I'm going to rotate my shin from the knee. I'm just going to roll this up. You might be able to see here this bony process at the top of my shin. For some people, they're like me, it's very, very pronounced. Other people, you can barely see it. But we try to find this bony process. It's called the tibial tuberosity. So it expands out there just below the kneecap and right at the top of the shin bone. So it's actually part of the shin bone, right? And then your knee ligament comes down and connects to that. So now I'm here, and what I'm looking to do is maintain my thigh line, so my femur stays where it is, and I'm going to aim to contract all of this stuff here at the back of the knee. Contract that, and what that's doing is I'm going to use the musculature to rotate my shin. So I externally rotated the whole shin, and now internally rotate that whole shin. And what you'll notice is it wasn't the ankle. So if I just took the ankle, it would look like that. The ankle would go out, so I'd get that bit of eversion. And if I took the ankle that way, I'd get that bit of inversion. So I'm going that way with the foot. Now I'm going to lock the foot into dorsiflexion just for the purposes of this exercise. And then I'm going to rotate the shin. So notice how the foot and the shin worked together. Right? So engaging all of these muscles here. Now if you have trouble doing this, it's likely that you have not spent any time contracting the muscles at the back of your knee. So what we need to do is practice that, right? We need to get a bit more adept at utilizing this musculature and really helping our knee to be able to motion actively through this range, through this rotational range. And what that does, it helps us to handle rotational and torsion-like forces. So a lot of knee injuries, especially ACL tears, are caused from torsion. So you're getting this rotational force through the knee that the knee can't handle. We can talk about later how that feeds as well from the hip or the ankle, but right now we're just going to look at the knee. So again, back to that idea, I'm trying to rotate this. If you're having some trouble just rotating, think about creating a downward pressure from your heel into the floor. So I'm creating a downward pressure, and with that I'm also creating a bit of a drag. So I'm creating this traction against the mat of my heel towards my buttocks, so it's going down and in, and then I'm using that. That's going to bring all of this muscle, all of this tissue on the back part of my leg, on the posterior portion of my leg. It's going to engage all of that tissue. Now I can use that to try and rotate. So I'm really engaging the areas that I want to engage and rotate. So two things, my thigh is staying dead still, my foot is moving with the shin. So my foot, my ankle is actually not doing any motion. My knee is doing the motion, and my foot is just going in that direction. So it's indicating, it's more like a flag or a pointer. And if I was just moving the foot, the shin wouldn't really move much. I would just be doing the ankle. So right now, ankle stays, shin moves. So that's the first thing. We want to just see if we can establish rotation in the knee, right? If it's difficult, we work on it a lot until it becomes easy. I want you to get to a point where you feel strong with that. So you feel like you can really create some serious contraction. Right now in the beginning, you just want to see if you can get it moving. And then as you feel better, more adept and more capable, you create more tension. So you really enhance this push down and this drag quality. And then you see if you can get more contraction out of the back of your leg. And you can see now maybe I'm shaking a bit. This is taking a lot more concentration, and it's taking a lot more concentration, there's a lot more tension, and it's strength work. So what I'm doing is contracting the musculature up to my safest, greatest capacity, so roughly 70% of its overall capacity, and I'm just isolating that joint and moving through that range of motion so I can actually strengthen those tissues so that they can handle more forces, specifically in this case, rotational forces through the